Welcome, everyone. Thank you for joining us for our first Lunch and Learn webinar of 2025. I'm really excited to have you all here. Our topic is Your Rights in Healthcare as a Person with a Disability under the Americans with Disabilities Act. My name is Savannah Bradley. I'm the Community Outreach and Programs Manager for the Pacific ADA Center. I am joined here today by our Deputy Director, Jan. Would you like to introduce yourself?
Yes, thank you, Savannah, and welcome everybody. We're really excited to have you. My name is Jan Garrett, and I'm the Deputy Director of ADA Programs for the Pacific ADA Center. And Savannah and I are going to present to you today about your rights under the ADA in healthcare.
Thank you, Jan. All right, before we jump into our presentation, I want to remind you all that this session is being recorded. It will be available on our YouTube page within the next week, so you can find it there and share it with anyone who might have missed today's presentation. If you have any questions throughout the presentation, go ahead and put those in the chat. Our host and panelists here can see your message, and we have some time saved at the end of the presentation for some Q&A. We might not get to every single question in the chat just because we're very limited on time with just the 1 hour of our Lunch and Learn series, but we'll provide you with our contact information so that you can reach us after our presentation if you have more things that you're curious about. Okay, so some information about us. The Pacific ADA Center is one of 10 regional centers in the ADA National Network. We cover Region 9. So on the right side of the slide is a map, and it shows all the different regions under the ADA National Network. For Region 9, we cover California, Arizona, Nevada, Hawaii, and the Pacific Basin territories. Our mission is to help people understand their rights and responsibilities under the ADA, and we do this by providing resources and training and support to help improve awareness and understanding of the ADA. Our center, we provide free and confidential information about the ADA over the phone and by email. We do this through technical assistance. We also provide training and conferences on the ADA. We provide resources and referrals, and we have a website that's available to the public. Our center does not provide advocacy services. We also don't provide legal services. Our center also does not enforce any laws, and we don't report contacts to any enforcement agencies. So any information that we share with you or any conversations that you have with us are always going to be confidential. All right, so the Americans with Disabilities Act, also known as the ADA, is a civil rights law that was signed in 1990. And this law is all about ensuring equal access and opportunity for people with disabilities. So in healthcare specifically, the ADA makes sure that people with disabilities have access to medical services without barriers. There are 5 titles or sections under the ADA, and then there are requirements under the ADA that entities have to follow and provide. So on the right-hand side of the screen, there's a list of the 5 titles under the ADA. Title 1 is employment, and this covers all aspects of the employment process. Title 2 is for state and local governments. Title 3 covers public accommodations. So here, this is for private businesses and private nonprofits that are open to the public. Title 4 is telecommunications, and then Title 5 is miscellaneous, and this is really a catch-all section of the ADA, and it talks about how you enforce the law and how it relates to other laws that exist. So the entities that are covered under these 5 titles, so again, that's going to be employers, state and local governments, private businesses and nonprofits, have to provide reasonable accommodations. They have to provide accessible locations for programs. They have to provide accessible websites and provide what's called effective communication. So they can do that through communication aids and services for people with hearing, speech, or vision disabilities. And they have to provide reasonable modifications to some policies and procedures when it's necessary. So for today, we're going to focus on Titles 2 and Title 3, which applies to state and local governments and private businesses that we'll learn how that also includes healthcare providers. So I'll break that down a little bit more in a couple of slides. But first, I wanted to talk about how the ADA defines a disability. So the ADA breaks this definition into 3 sections or 3 parts, and it's a very broad definition. So the first part of this definition is that a person has a disability if they have a physical or mental impairment that substantially limits one or more major life activity. On the right-hand side of the screen, there's a list of some examples of major life activities. So that would be things like walking, seeing, hearing, speaking, breathing, cognitive functioning, concentrating, or normal cell growth. So think of cancer in this instance. There's a lot more major life activities to consider. This is just an example. The second part of this definition is having a record or history of such an impairment. So going back to the cancer example, if a person had cancer in the past, received treatment, and is now in remission, they would be covered under this part of the definition of disability under the ADA. And then the last part of the definition of a disability is being regarded as or assumed to have such an impairment. Okay, so bringing us back to Titles 2 and Titles 3. So we remember in the last couple of slides, we learned that state and local government is covered under Title 2, and private businesses and private nonprofit organizations are covered under Title 3. When we think about healthcare, there are also healthcare clinics and healthcare systems that fall under these 2 different titles. So under Title 2, it would include things like public hospitals, county and health clinics, and university-affiliated health systems. So basically, if the clinic or medical office is run by the government, it's going to be covered under Title 2. And then for Title 3, this would include private medical offices and other practices like dental offices, mental health clinics, chiropractors, urgent care centers, all of the privately run medical offices that we go to. So both of the entities under these 2 titles have obligations to make their services accessible. One of the differences here is that under Title 2, it does have slightly broader requirements, but both titles do require that they provide access to all of their patients, that it's non-discriminatory, and that they provide reasonable accommodations or modifications. Okay, so places of public accommodation. So this is diving deeper into Title 3. So remember, this is places of accommodation refers to any private business or private nonprofit that is open to the public, that is providing goods or services to the public. And so under this, private healthcare providers are considered public accommodations under the ADA. And so this means they cannot discriminate and they must ensure access. The ADA doesn't say how big a practice needs to be. It just says that if they serve the public, they have to follow these requirements under the ADA. So we might hear some providers say, I'm just one person in my practice, or, my office is an older building, but that doesn't exempt them from ADA compliance. All right, so this slide shows a list of some examples of what places of public accommodations can be. So again, these are private businesses and nonprofits that serve the public, and it can be all kinds of places like retail spaces, restaurants, gyms, and it could also include clinics and other, medical and clinical offices. What we have bolded on the left side of the screen is service establishments, and this is a big category where healthcare would fit in. So that would include many of the doctor's offices. On the right-hand side of the screen, you'll see education sites and social service establishments. So here, think of campus health centers, school-based mental health services, or even nonprofits that are offering counseling or health screenings. So this is where healthcare settings fit under public accommodations. All right, so public accommodations, so all of these medical offices that fall under public accommodations, they have to modify their policies and their practices so that people with disabilities can participate in their services and have access to care. And they can do this by providing reasonable modifications, which means that the healthcare providers have to adjust how they do things. They're not necessarily lowering the standards of care or changing the quality of care, but simply how it's delivered. So, for example, if a clinic has a policy that has, patients must fill out intake forms on their own, this policy may need to be modified for someone who is blind, has limited dexterity in their hands, or a cognitive disability. So a modification could look like, staff reading the questions aloud and recording the answers, or providing the form in an accessible format like large print or even electronically. Another example that you could see in a healthcare setting is in the appointment check-in process. So a patient with autism or anxiety might have trouble waiting in a crowded reception area. So a provider could allow them to wait in a more quiet space or in their car until they're ready to be seen. Those are some examples of reasonable modifications in healthcare settings. And then there's also the transfers to medical equipment. This is another policy that we sometimes see in healthcare settings. So there's, some clinics that have what's called a no lift policy. And this means that staff are often instructed to not physically assist patients with transfers. And this is usually done to prevent injury to staff as well as to the patient. But ultimately what it does is it creates a barrier for people who do need assistance with these transfers in medical settings. There are lots of ways to assist patients with transfers in healthcare settings without injuring staff or patients. So for example, maybe you can use two people or multiple people to safely transfer someone from one place to the other. Maybe it's from their chair onto, an exam table or to another chair. So there's definitely ways to make it happen. And, under the ADA, if the patient needs help getting onto to an exam table or to a chair, the provider, they can't simply say no. So they do have to provide that reasonable modification and should always listen to the patient's instructions about how to assist them. The patient often knows best what works for them. Okay. Service animals are another common reasonable modification for no pet policies in healthcare settings and in public accommodations in general. On this slide, on the right-hand side, we have a picture of a service dog who is posing outdoors, sitting on grass. So under the ADA, a service animal is defined as any dog that is individually trained to do work or perform tasks for the benefit of a person with disability. The only exception to it being a dog is that it can also be a miniature horse. So again, it could be a dog or a miniature horse, and it has to perform a specific task for a person with a disability. When you're in a place of public accommodation, if you're in a healthcare setting, the staff there can only ask two questions about a service animal. So the first question is, is this a service animal that's required because of a disability? That's question one. And the second question is, what specific task has the animal been trained to perform? Those are the only two questions that staff can ask a service animal handler. They cannot ask for documentation. They can't demand the animal to perform the task on the spot. And they also cannot ask a person about their disability. All right. So in healthcare settings, service animals are generally allowed. There are a few specific situations where they might be restricted for safety or health reasons. And this typically applies to areas with strict infection control protocols. So think of your surgery or your burn units. So you want to reduce contamination and keep those environments sterile. So those are some situations where a service animal might be restricted from being in the same room as their handler. Um, Even then, if a patient is separated from their service animal, the staff does have obligations to help and support the patient. So um, if the service animal has to be separated from the handler, they have to help determine with the patient what are the plans, what are the arrangements for supervision and care of the service animal during the period of separation. So that's point one. And then the second part is they also have to work with the patient to make appropriate arrangements that address the patient's needs in the absence of the service animal. So, for example, if the animal is helping a person with balance, then the staff might help with walking and help provide that support during that period of separation. If an animal helps the patient with anxiety or a medical alert function, providers can also ask, what the patient needs to feel safe and secure during that care and provide that support. So even when a service animal has to be separated from their person, healthcare staff do have an obligation to provide support during that time. And I want to check in with my colleague Jan. Is there anything in particular that I missed regarding service animals or even transfers?
No, that's all great. And we do have some questions in the chat that we will answer about animals and other things. But I just wanted to address two things before I start with the next ones. And great job, Savannah. Is that one is that there's apparently an intermittent Zoom outage somewhere. So apologies to people who may have joined in late because the link wasn't working for you. And there may be some people who will need to hear the recording. And get the slides for later on. So we apologize for that, but that's a Zoom thing, not a Pacific ADA thing. The other thing I just wanted to let you all know is that yes, we have limited the chat to the hosts and panelists. So in that way, anybody who is using a screen reader will not be hearing all the chat messages. Usually there is a Q&A option in a webinar, but we wanted this to be a meeting so that we could have it be a little bit more participatory, but we have made access better by having the chat only go to the hosts and panelists. So I just wanted to make sure that folks knew that for people who may be using a screen reader. Also, we will be getting to people who have raised their hands in just a few moments. Sorry, we'll get to all those questions in just a few minutes. So let's move on to the next slide. So one of the things that's relatively new in the ADA Title II, which is state and local government regulations, is information on medical diagnostic equipment. And medical diagnostic equipment is equipment that's used by healthcare providers in hospitals or doctors' offices, other places for diagnostic purposes. So that's like a weight scale or an x-ray machine or other kinds of exam tables, things that will help do diagnoses and help treat people when they are in a hospital or in a medical office. And that equipment, can also include mammography equipment, and examination chairs, so like in dental offices or eye exams. So there's lots of different examples of equipment, of medical diagnostic equipment. Next slide. So entities, and that is state and local governments, have to ensure that their services remain accessible to people by modifying their existing equipment, if that can be done and if that's necessary, by relocating their services, or by acquiring accessible equipment as necessary. So they may have to purchase some accessible medical diagnostic equipment in order to comply with these regulations if you are a state or local government. I do believe that private doctor's offices and private hospitals should also be doing this, but this is information that is not in the ADA Title III regulations. It's in ADA Title II, state and local governments. But regardless, it would really be helpful if private medical providers and private hospitals could also be able to talk about and acquire accessible equipment. So also we need to understand that staff have to be trained to operate accessible medical diagnostic equipment and assist people with disabilities effectively. So staff training is really a key thing in medical diagnostic equipment, but in any part of the ADA. So by August of 2026, any entity that is state or local government that's using an exam table or a weight scale, that entity is required to have at least one accessible exam table and one accessible weight scale. So again, this is by August of 2026. This is state and local government entities. And they have to, if they use exam tables or exam chairs or weight scales, they're required to have at least one of those in their office or in their hospital. Next slide. So let's talk a little bit. I've noticed some of the questions in the chat about what happens with buildings that were built before the ADA came into being, in other words, before it became effective. And so there's different rules for what ADA Title II entities or state or local government entities have to do as opposed to private nonprofits and private businesses under ADA Title III. So state and local governments under ADA Title II have to provide what's called program accessibility for their buildings and facilities that were built before the ADA. And so what that means is that all programs, services, and activities of the entity has to be accessible, but not necessarily all of the buildings of a public entity have to be accessible. As long as the programs are offered in an accessible facility or building, then it's the program accessibility that is important. Of course, we need to make sure that we mention that any building or facility that was built or altered after the ADA came into effect does need to comply with new construction and or alteration requirements in the ADA. Program accessibility is for state and local government buildings and facilities that were built before the ADA became effective. Okay, so that means that they have to provide accessibility to their programs, services, and activities. Next slide. So as Savannah was talking about earlier, ADA Title III talks about private nonprofits and private businesses that may be open to the public. And so what they have to do is what's called readily achievable barrier removal for their buildings and facilities that were built before the ADA became effective. So they have to remove those accessibility barriers when it is readily achievable to do that. The general definition of readily achievable means easily accomplishable and able to be carried out without much difficulty or expense. And what that means sort of in non-lawyer terms is basically it means when it's cheap and easy to remove those accessibility barriers. Okay, and examples of accessible, readily achievable barriers can include like ramping one or two steps at an entrance to a building, as long as you ramp it properly with all the safety requirements for a ramp. You could change doorknobs to lever handles, which would make them easier to use with people who can't grasp a doorknob and turn it. Also, we need to make sure that we say that the barrier removal obligation, the obligation to remove accessibility barriers, is ongoing and has been for any facility or building that existed before the ADA requirements came into play. So you need to keep removing barriers and keep doing that for readily achievable barrier removal. Next slide. So some other examples of barriers that can occur specifically in healthcare settings could be that there is no accessible parking, even though parking is actually offered at the healthcare place, at the doctor's office, dentist office, or hospital. There could also be steps at an entrance. And unless you have an accessible entrance with a ramp or no steps, people cannot get in that use mobility devices. You could have doorways that are too narrow, either at the entrance to the building or even the exam rooms or diagnostic rooms inside. And you need to make sure that your doorways are at least 32 inches wide. You can also have exam rooms or treatment rooms that are too small for people to maneuver in, for somebody to be able to kind of turn their wheelchair around or their mobility device. You could also have high counters at the check-in or reception desk, which can pose a barrier for some people in terms of physical accessibility. And there's other barriers that can come up as well beyond just the physical barriers. For example, the kiosks that a lot of healthcare places are using now and that are not accessible, not only may they not be within a reach range, but they also may not be accessible to people who are blind or have low vision, because they are typically a touch screen, and there may not be anyone to assist you with the kiosk if you're using the kiosk to check in for your healthcare appointment. Next slide. So in addition to all of the accessibility requirements that state and local governments and public accommodations have, you also have requirements to make sure that people with communication-related disabilities have communication access that is equally effective to that is provided to people without those communication-related disabilities. And the ADA defines communication-related disabilities specifically as hearing, vision, and/or speech disabilities, because some people may have more than one of those disabilities, but effective communication requirements are for people that have hearing, vision, and/or speech disabilities, or any combination of those disabilities. And the effective communication has to be provided through communication or auxiliary aids and services. Okay, and so the next slide, we will show you what are auxiliary aids and services. So some examples are qualified sign language interpreters for somebody who is deaf and actually uses sign language to communicate. You need to find out what kind of communication somebody needs in order to be able to offer the appropriate auxiliary aid or service. Also, some people may use real-time captioning instead of sign language interpreters, because they may not know sign language, but they also may have a hearing disability. And so they need to have the captioning available to them that is in words as opposed to American Sign Language. Some people can use assistive listening devices in areas that have amplified sound. And so their hearing aid can connect into the assistive listening device, or they can have a headset that they wear where there is an amplification of the sound that they can hear using that device. You can also use telephone relay services. There are relay operators that you can call by dialing 711 and be able to use that relay operator to make a call for you. If you have a hearing, typically it's hearing or speech disability, and you can either sign with that relay interpreter through a computer where you both have computers and you can both see each other on a monitor, or you can use a TTY and be able to communicate with the relay operator in that way. And then the relay operator will make the call for you and be able to convey what you are saying to the other person and what the other person says back to you if that is needed. If, in other words, if somebody cannot hear them and they need that interpreter or that relay operator to relay back what's being said in sign language. You can also, for very brief conversations, exchange written notes. For example, at a library, when is this book due? And then the librarian can write on a piece of paper what the date is that the book is due. That's just an example, but that would be a very simple, brief conversation where exchanging written notes might be effective as a means of communication. And then for people with vision disabilities, somebody may need a qualified reader. That means somebody who can read whatever document it is and is qualified to read that document. In other words, may know some of the terminology and can be able to read it and pronounce it correctly. And so in a healthcare setting, you may need somebody to read you the instructions that you need after you've received a particular diagnosis or you've had a certain kind of procedure. And there may be specific instructions from the medical provider that say what you need to do when you leave the office or the hospital. And so somebody would need to be able to read those instructions to you. You also may need to provide for people with vision disabilities large print, and we usually say it's 18-point font or above. Some people still can use Braille, and you may, for shorter documents, need to be able to provide Braille documents. You also may be able to provide things electronically or on some sort of the audio cassette or CD if people don't have computers and they need it be able to be dictated to them with something that they can listen to. But most people these days that have vision disabilities have computers, and so electronic documents are typically what is needed for those folks. Next slide. So when do you know that communication is effective? So if you're a public entity, if you're a state or local government, in other words, you have to give what's called primary consideration, that is first choice, to the communication aid or service that the person requests. So if they request a sign language interpreter, that's what you need to try your best to provide. If they request captioning, that's what you need to provide. If they request a qualified reader, that's what you need to provide. And then public accommodations, however, like private businesses, private nonprofits, can choose what communication aid or service they use. However, regardless of whether you're a state or local government or you're a place of public accommodation, the communication that you offer to people with communication-related disabilities has to be effective. And you know it is effective when the person actually understands the information. So you may want to ask a couple of times, can you, are you understanding what I'm telling you? Maybe ask the person to repeat back to you briefly what you have said. Obviously not every sentence that you say, but to get a sense of whether or not they are understanding and when the communication is effective, to make sure that that is actually happening for the person with the communication disability. Next slide. So surcharges. Neither public entities nor public accommodations may place a surcharge on people with disabilities or groups of people with disabilities to cover any additional costs that they may need to comply with the ADA. So, for example, the charge that would be imposed for using a sign language interpreter or a captioner, or maybe even hiring a qualified reader or producing a document in Braille. All of those things are costs of doing business, and you must, as a healthcare provider, absorb that cost. You cannot charge the person with the disability for that cost. That would be a surcharge, and that is not allowed under the ADA. Also, you cannot charge for something like cleaning an extra janitorial service for service animal fur that may be left in exam rooms when somebody comes in with their service animal. So you cannot charge for that either. If a service animal actually does damage to something, you can charge the handler for that damage, but not just shedding. That is not something that you can charge someone for. Next slide. So all of this is to say, so what if you're not getting your rights enforced? What if you feel like you're not getting your effective communication? What if you're being turned away with your service animal? What if you're not being helped to transfer to exam table? Any of the things that we have just mentioned that you have rights to ask for, the first thing you should do, obviously, is ask for somebody, the highest level person that you can, or somebody that actually deals with the ADA. Do they have an ADA coordinator on site or somebody that you can talk with that is responsible for ADA compliance? And try at first to talk to the people while you are there and to try to resolve it during your appointment while you are actually at the healthcare provider. If you cannot do that, if that does not work, you can do some self-advocacy as one way of enforcing your rights. You can contact your local independent living center, and we can give people information about where to find their local independent living center if they need that, or your local disability rights center that serves your state and your area. So you can do some self-advocacy by contacting those organizations. You can also file a complaint with the Department of Justice and ask that they do ADA enforcement. On ada.gov, there is a place to go to file a complaint. And you can do that on their website, or there is a phone number also that you can call them if you really need to be able to call and phone in your complaint instead of filling it out online. You can also file a complaint with the U.S. Department of Health and Human Services if you have Section 504 requirements that are not being complied with, which is when there is federal financial assistance given to a particular healthcare provider. And they're not complying with Section 504's healthcare requirements that Health and Human Services has. Also, Health and Human Services can help with HIPAA enforcement, which is a separate law from the ADA. Okay, and next slide. The other thing you could do also is that you could file a private lawsuit. And you always have the right to be able to do that in addition to filing complaints or using your advocacy services. So we have some resources that are listed here. The ADA National Network website that we are a part of at the Pacific ADA Center is at adata.gov, .org. The U.S. Department of Justice ADA information line is at ada.gov. U.S. Department of Health and Human Services Section 504 fact sheet is at the long, basically, I don't know. Sorry, I'm losing my words. But basically, your fact sheets. And then U.S. Department of Health and Human Services HIPAA information has another area that you'll be able to click on. And then also you have access to medical care for individuals with disabilities. There is a fact sheet that is available at USDOJ for that. Next slide. And then hopefully you will stay in touch with us. This is how you contact us by phone, by email, by our website, to join our listserv. Hopefully you will subscribe and know what's going on. We have a really excellent monthly newsletter. And then we want you to also follow us on social media if you're able to do that on the Blue Sky, at the Pacific ADA Center on LinkedIn, on YouTube, and on Facebook. and on X or Twitter. So we really encourage you to be able to follow us on social media and to follow our emails by going and joining our listserv and by following our website updates at adapacific.org. We also really encourage you to complete our evaluation survey. That is in the link below, and it is also posted again by Savannah, and I posted it earlier in the chat. So hopefully everyone will complete the evaluation survey after today, and we can go to the next slide and say thank you very much for your participation. And at this point, we can take some questions. And I know there are lots of questions in the chat, but I want to just start with Dawn because Dawn raised their hand earlier. And so let's start with Dawn, and then Savannah, maybe you can look through and find some of the first chat questions that we've been going through. Dawn, do you want to unmute? Are you able to unmute? Okay, I don't see you. So Savannah, what are the other?
So I have the chat pulled up and I see a question from Christine. What if the building was made before the ADA? Do they get grandfathered in? It's a great question.
It is a great question, and the answer is it actually is no grandfathering. The answer is if you're a state or local government, you have to comply with program access. So that means your program services and activities have to be accessible, even for buildings and facilities that were built before the ADA. And then if you're a private entity, like a private business or a private nonprofit, you have to do readily achievable barrier removal for your accessibility barriers for any buildings or facilities built before the ADA. So there's no such thing as grandfathering. Either you do program access when you're a state or local government, or you do readily achievable barrier removal. And those are both ongoing obligations that take us as we move forward in our 35th anniversary of the ADA.
All right, we have a couple of questions around service animals. Can other animals get trained to perform services, and are miniature horses still part of the ADA definition? There was a thought that they might have been eliminated.
Okay, and so no, miniature horses were not eliminated. They're actually in the regulations, and you may have to modify your policies, practices, and procedures to allow a miniature horse, but generally service animals are dogs. Okay, they are dogs unless it's a miniature horse, no other animals. And so you would have to modify your no pet policy to allow a dog. And what was the first part of the question?
Are there other animals that can be
Right.
trained to perform services?
Well, I mean, you can have other animals as emotional support animals in your housing, if that is what you are seeking. So those could be, other animals, typically not exotic animals, but they can be beyond dogs. But service animals are only dogs or miniature horses.
All right, one more service animal question. Can a patient refuse the service animal questions?
No. If the person asks, if the staff member asks the two questions that are allowed, is this a service animal needed because of a disability? And then if the answer is yes, then what task does the animal perform? And the person can answer that. Then you do have to answer those two questions. Those are allowed under the ADA, and you are required to answer them. Now, you don't have to answer any other questions about your disability. You don't have to show what the service animal does to the person, but you definitely are required to answer those two questions. Yes.
We have a really great suggestion in the chat. It says, is there an ADA information card that you can give to a staff member about the service animal and their rights, particularly for entities that aren't following the rules? This person has a client that gets turned away with her service animal due to her disability being non-apparent and varied by day.
Okay. Well, yeah, and you could create your own card if you wanted to. We also have what we call a pocket guide, which goes through some of the requirements for service animals. And we could send you that if that would be helpful, in addition to maybe the card that explains, what task the service animal does for this particular client, because the service animal pocket guide won't be specific about a particular person, but you could add to that maybe with some sort of an index card that says, if they cannot articulate it, what the animal does for them. So yes, you could create a little card to go along with that pocket guide.
And we can help you with that too. If you want to reach out to us, send us an email, give us a call. We also have fact sheets on our website with information that, is on one page that would be easy to carry.
Yes. Yes, feel free to do that or reach out to us if you want the pocket guide.
All right, so how can we receive a copy of this presentation? This is being recorded. It will be on YouTube within the next week, so you can look for a specific ADA Center on YouTube.
And
We
I
have, oh,
yeah, I do believe that people will be able to get a copy of the slides
yes,
as well.
yes. All right, we have a question about Section 504 and its applicability as medical offices operate receiving federal funds through grants and Medicare and Medicaid services. I'm not sure what the question is. It says, my question is about Section 504, applicability as medical office operates receiving federal funds through grants and Medicare and Medicaid services. Section 1557 of the ACA is applicable across the board.
Yes, yes, Section 1557 of the Affordable Care Act is also applicable. And yes, it is Medicare or Medicaid. In California, we call it Medi-Cal, but it's called Medicaid, nationwide. And those are federal funds that actually do bring in Section 504. And U.S. Department of Health and Human Services has some specific regulations under Section 504 and some specific fact sheets that they talk about on their website, and that we've included that in our resources on that slide about Health and Human Services that you're going to want to look at. And I believe there is also information about Section 1557 that U.S. Department of Health and Human Services has on their website, their civil rights website as well.
Okay. We have the next question. It says, under which title would a continuous care facility be governed? Can a continuous care facility whose residents range from independent to assisted clients refuse to take a wheelchair user if they cannot independently transfer from wheelchair to a car seat?
Well, again, I think that comes back to reasonable modification of policy that's required by any entity that's covered under the ADA. And if somebody needs assistance to transfer to a seat in an automobile, or to otherwise transfer, then that is assistance that would need to be provided. And I think it would be a problematic decision to say that you're refusing that somebody can be part of that continuous care facility if they cannot independently transfer themselves to a car. Always the ADA says that you need to look at each case on a case-by-case basis, each person on an individual basis, but you always need to be open to modifying policies, practices, and procedures. And so I would be very careful if I were that facility about declining people for that specific reason.
We have a couple of questions around building accessibility. So the first one is a medical office that rents a space, and they're asking who is responsible for making the entrance of this building accessible? Is it the practice, the medical office that's renting the space, or is it the owner of the building?
Actually, it kind of depends on the lease. As far as the ADA is concerned, both parties are responsible, both commercial tenants and commercial landlords or owners of buildings are legally responsible because they own, lease, or lease to a place of public accommodation if you're a medical office. So everyone is responsible, but you probably want to check the lease to determine which parts of the building is the landlord or building owner specifically responsible for. Typically, they're responsible for things like the parking and the lobby and other areas, but the tenant space where the actual medical office is typically responsible for their own space and like any restrooms or rooms that they have built out in their tenant space. But again, that can vary in the lease, and I would suggest that you check what the lease is for the building where your medical office is located.
There is a comment about a restaurant that's on the second floor. They don't have elevators, and they say it's not cheap and easy, and that's in quotation marks, to fix. Do they get a pass?
Okay, well, it's a restaurant. I mean, I'm going to give you the Department of Justice answer, which is it depends. It depends on how long the restaurant has been there. Typically, an elevator would not be considered something that is readily achievable to do. But it depends on how long the restaurant has been there. It depends on how long they may have saved back money. It depends on whether or not there are other options for that. Maybe like a porch lift that would be less expensive than an elevator, or perhaps a ramp could be built if there's room for it. So there's lots of potential options to look at. And I would say the restaurant needs to look at what is possible. If nothing else is possible other than an elevator, and that is truly not readily achievable for them, then they need to consider whether or not they could actually bring food down for people to take away if people specifically wanted their food, but that they could not actually get to the restaurant itself. But certainly they should try everything possible to create access to their restaurant.
All right, thank you. And I stopped screen sharing the slides after seeing the comment that requested that for better visibility of our ASL interpreter.
Great.
Okay, does obesity qualify as an ADA consideration when it comes to accessibility modifications?
I'm sorry, does a what qualify?
Does obesity qualify?
Obesity, okay. Is it considered a disability? Um, no, obesity in and of itself is not considered a disability, but there could be other things that go along with obesity, like people sometimes have difficulty with their knees or their hips, and that could substantially limit their ability to walk and move around. It could also cause other health issues, heart issues, respiratory issues, other issues that could be actually considered a disability if they substantially limit one or more major life activities. Again, like walking or like breathing or like your heart function or even type 2 diabetes because that affects your endocrine function. So there are things that go with obesity that could definitely be considered disabilities, but not the obesity itself.
All right, we have more questions around service animals. This one says, how can you acquire a certified service animal? And I'll say that certified service animal isn't something that is required under the ADA. There are a lot of businesses that you can find online that will sell you a certificate for your service animal. Jan, you like to say that that paper is not worth the the paper, or what is it? The
It's
paper
not worth the paper
printed
it's
on.
printed on,
There you
right?
go. As long as your service animal meets the definition under the ADA, which means that it's trained to perform a specific task for a person with a disability, and it is either a dog or a miniature horse, then your service animal qualifies under the ADA. So there isn't a process to certify your service animal. Are emotional support animals, do they need to be accepted in rental places that do not allow animals?
I would say yes, generally they do. The Fair Housing Act says you can ask for a reasonable accommodation under the Fair Housing Act for having an emotional support animal. Now, different from service animals, the housing provider can ask for documentation that shows how the animal provides emotional support from a rehab professional or a medical professional. So with service animals, you cannot ask for documentation, but emotional support animals in residential settings, yes, you can ask for documentation. And yes, emotional support animals should be allowed as a reasonable accommodation in housing, unless there is some reason why the animal is, a nuisance or completely out of control or some other reason. But generally, yes, it should be allowed as a reasonable accommodation under the Fair Housing Act.
All right, we have a very specific question about toilet seats. So what are the standard ADA toilet height? And is there a requirement for additional handles?
Okay, well, generally a toilet seat, the top of a toilet seat is 17 to 19 inches above the finished floor. And in terms of, are there additional requirements for handholds? I'm guessing that what you mean is grab bars. And yes, there does have to be a grab bar on the side and in the rear of the water closet or toilet. And there are specific requirements for how long those grab bars have to be, where they're supposed to be placed, what height they're supposed to be at. So there's lots of different grab bar requirements that are too much to get into today. But if you want to contact us by phone or email, we're happy to provide that information to you.
Okay, I have reached the bottom of the chat here.
And I see one that says, are ESAs allowed in Airbnbs?
Yes.
Um, An Airbnb would be considered a place of lodging under the ADA, which is, like a hotel, motel, inn, because you rent it typically from the owner. You don't own it, and it's not housing that you're going to continue to live in. And so the answer would be no. Only service animals should be allowed in Airbnbs because they are not residential. They are not typically covered under the Fair Housing Act. And the Fair Housing Act is what allows emotional support animals. Okay. And Savannah put in again our phone number and our email address and our website. Thank you, Savannah, for doing all of that. And then I see one question that says, please, this is probably the last question, please touch on the effects of the federal government recently removing guidance on enforcement of the ADA, specifically bringing caregivers into hospitals. Yeah, I don't know about that particular guidance document. That may have been one of the ones that was that was pulled. I know there were specifically 11 guidance documents that the Department of Justice said that they were, pulling from the website and from Access. Several of them had to do with COVID, and that may have talked about caregivers in hospitals and COVID. I know there are specific U.S. Department of Health and Human Services requirements that are still there for caregivers in hospitals, and whether it's during COVID or in other requirements. So that's still there, and I believe that generally. Again, reasonable modifications, you should ask for a reasonable modification to have a caregiver in a hospital, even if that specific guidance document is no longer available on ada.gov. And, it's always troubling when any guidance documents get pulled from the civil rights websites. But I would say, at least there certainly are some that are still available on ada.gov. And if you are experiencing problems with an area where one of the guidance documents used to be there, but is no longer there, please let us know that, because we may be able to then get a groundswell of public opinion that says you need to add this one back in. because there are you know, enough people that are experiencing problems, and they need that guidance document to be back on the ada.gov website. So please let us know if you're experiencing problems with something that was removed from the Department of Justice ADA website.
I have put our contact information in the chat one more time. And I also dropped our evaluation survey. Please take that. You can click on the link and have the window open and complete it later today if that's easiest for you. I know that we are at time, and I want to thank you all for being here with us. Thank you for all of the really great questions. Please reach out to us if you still have more questions. If for some reason we didn't get to yours, we do want to hear from you. So please give us a call, send us an email, and take our evaluation survey. Thank you so much, everyone.
Thank you so much for being here today. Please do the evaluation for us. Thank you. And thank you to our interpreters and captioner as well.